was born in San Antonio, Texas. My great-great-great-grandfather came here in 1835 and settled a family, and we've been here ever since. I went to college at the University of Notre Dame in South Bend, Indiana. I became a doctor starting from a strong interest in science and did some internships, externships along the way, and really involved, I really liked the involvement with working with people on a daily basis, but the science also that goes behind it. And it's been very rewarding. I've been doing it for near 15 years now and seem to love it more every day. I went to medical school at the University of Texas in Houston at the Health Science Center there, followed by my residency at Washington University in St. Louis. Then I did further training in cornea, external disease, and refractive surgery with a fellowship also at Washington University in St. Louis. So I'm board certified in ophthalmology. That basically means there's some additional testing that this national body does every 10 years to make sure ophthalmologists are up on current medicine trends and surgery. I learned Spanish mostly from living in San Antonio, which I think practicing medicine in San Antonio, speaking Spanish is really a requisite. But I primarily learned Spanish working in Mexico in a dive shop. And so I first learned dive shop Spanish and then more medical Spanish following that. So we keep up with the incredible fast pace of technology in medicine, mainly by attending national meetings, and we even participate in a lot of the teaching and education of other physicians, which is where you really learn a lot to stay at the leading edge of the technology. It's nice working in a group practice also, because we also learn from each other. We're all board certified here and also have all done cornea fellowships. So the nature of my practice is primarily a surgical consultative practice. We're mostly consulted by other physicians and optometrists and others in the medical field for surgical problems, a lot of cataract surgery, cornea transplants, LASIK. In addition, we do handle a lot of the toughest problems around as far as eye diseases that can also be managed medically. So in San Antonio, diabetes is really epidemic, and so every ophthalmologic practice and probably medicine practice really has to be adept at the specific problems with diabetics, which can be a lot of problems with the cornea, a lot of problems with the retina. Diabetics also get a lot of cataracts, and so we're very in tune with those treatments for diabetics, and they tend to need more care. Specific conditions related to diabetes that are often referred to us involve cornea problems where diabetics don't feel their cornea. They actually get a neuropathy in their corneas. And diabetics also have a higher rate of cataract, which we specialize in fixing. One of the biggest moments of joy is bringing some of these new technologies to San Antonio and South Texas. And we've been the first to bring a lot of these technologies. And most recently, we've been doing a version of a cornea transplant called DMEC, where there are really only a handful of people in the country who are doing it now. And one of the moments of joy is amongst those first cases when we take the patch off the next day, and the recovery and the sight these people have even very early on is astounding to both the patient and the surgeon sometimes, because it just seems to work better than some of the older surgeries we've been doing. I feel my role as a physician is, number one, to take care of people and help with their quality of life. Many people come with very serious vision conditions, and especially the talk of sometimes surgery is very scary. And in addition to just fixing the problem, I want to hold their hand going through it and make sure the fears are not taking over as far as their anxiety, and make sure that the whole person is taken care of. We want to make sure you're seeing better, but we also want to make sure that your overall well-being has been taken care of at the same time. You know, one of the biggest precepts of medicine is above all do no harm. And many times the most appropriate action, you know, even with the advanced care we have these days, is do nothing at all, or not recommend a surgery, or you know, talk with the patient and to make sure that you know, it's in line with how they want to live. Because not everybody necessarily will want you know, the most advanced or the most prescient intervention that is needed or available, and really above all do no harm. One unique thing about I think our practice is the physicians involved, and that we are really like-minded and very interested in truly taking care of people and making sure people have the most advanced care. We really work as a team. I have found really what I consider the best partner in the world as far as Dr. Lehman, who we really can work interchangeably, and making sure if I'm not available that he'll take care of you and vice versa. He's been a very good partner and is who I would go to if I had an eye problem, and has become really my best friend. And so we take care of patients, but partly we do it by making sure that our practices run well, and it's easy to do when you have, you know, someone you trust as your partner.